So if you have EDS, it is a hypermobile connective tissue disorder. Exercise and rehab is your friend, but you kind of have to be picky how you do it. In this particular article, Exercise and Rehabilitation in People with Ehlers-Danlos Syndrome, a systematic review, it shows some pretty cool things. If you don't know me, I'm Dr. Wendy. I'm a physical therapist, and half of my caseload are women with EDS. And so my job in life is to make my patients feel better, read the research, and tell you guys what you can do. Now, if you don't know what EDS is characterized by an abnormal synthesis, meaning creation, or function of the collagen, fibrillin, and elastin in the body that typically affects the GI, so your insides, cardiovascular, and musculoskeletal systems. The exact prevalence of EDS is unknown. And might I stress this? Because if you go to websites and journals, they will show the prevalence, and it's an estimation. Because there is a sincere problem diagnosing people. For instance, I live in Dayton, Ohio. If you are in Dayton, Ohio, there is really only a handful of places you can go to get diagnosed. And sometimes my patients are rejected because if you don't have a family member already diagnosed, they won't diagnose you. But if somebody doesn't have a diagnosis, how can do you see the disconnect? You can't even go to Cincinnati Children's to get a diagnosis because you have to be in the 5 counties surrounding Cincinnati. So whenever I see this, I just think to myself, there's a lot more people with EDS than we know, but let's carry on. So EDS typically manifests as a fragile skin, organ dysfunction, significant diffuse pain, yes, and a hypermobility that can lead to recurrent joint dislocations and other injuries. Yes, if you think you are super clumsy, and I would say you're a tumbleina and you can trip over air, you can trip over grass, and you trip in your driveway that you've walked in 100,000 times, you may have EDS. What we know about EDS has really changed over the past 30 years, and sometimes the old information is all the information that people know. But there are 13 different subtypes, and of these subtypes, 12 are usually confirmed by a molecular analysis. However, the most common one, the hypermobile EDS, is not oftentimes confirmed, and so genetic-wise, we don't know everything we need to know, but please do know if you think you have EDS and a family member has EDS, you probably have EDS. So let's work off that assumption that this applies to you. Now, many people that have EDS may have kinesiophobia, a fear of physical movement and activity. That is true, because if you were always breaking, you would be scared too. This reminds me of a character from the original Wizard of Oz book, and she was like the little Bo Peep, I believe, made of porcelain. I don't know, somebody needs to help me out here. But I remember when I read that book, it was interesting because she was delicate and she was always worried about tripping on the brick road because if she got a crack, she'd never be perfect. And that's kind of like how I think of my EDS patients, that sometimes they may be afraid because really they do have bad things that happen to them all the time, and they sometimes have bad awareness of their body and space. This fear also contributes to poor quality of life. Yeah, because if you're afraid of going to a concert with your friends because you're afraid somebody's going to push into you, or if you're afraid of going to Disney World because you're afraid somebody's going to push into you, yeah, it can affect your quality of life and then cause further impairments. What will happen is sometimes these people become deconditioned because they aren't going out, and that is understandable. This is why a physical therapist that understands EDS and you is very, very important. So exercise and rehab for people with EDS have commonly focused on optimizing physical function with improved muscular strength, proprioceptive activities, meaning balance, spatial awareness, and postural exercises such as lumbar spine stabilization and trunk muscle endurance exercises, meaning things that involve your abs, because if you can control your abs and other muscles that control your posture, you have a better chance of controlling your arms and legs. Because if your abs are weak, you have no foundation to stand on. And this is why in the other video, I shared this article showing we're telling you we need you to focus on your abs, but this article says your abs are sometimes rubbish and don't fire as well or as thick. It doesn't mean we don't try, we just have to be very strategic. Okay, back to this article. At the end of the day, this article talks about horizontal exercise being some of the best exercises for patients with EDS. And anecdotally, I can tell you this is true. The exercises that would be horizontal exercises, meaning you could be on a recumbent bike, you could be on a Pilates reformer, you could do a rowing machine, you could do swimming, you could do table exercises. These are things all my patients tell me that they're their favorites. Actually, one of my patients jokingly says using the rower is like a poor man's Pilates. And I don't know that I disagree, because the ab strength she got looks like she's been doing Pilates. But as I tell every one of my patients, the best exercise is the one you actually will do. So if you have EDS, I encourage you to find a horizontal activity that actually works for you. And I know when I say horizontal activity, it makes it sound like I'm talking about something else. And that's not what I'm talking about. But if you have EDS, I encourage you to find a physical therapist that understands you and can help you make an exercise program. There are some personal trainers that specialize in EDS, but it is very, very, very rare. But hit the plus sign and follow for more women's health and wellness tips. Bye. Oh, and I have a research study that's happening right now I'm about to start recruiting for EDS. If you are in the Dayton area, just want to let you know you could be in my study. And we're going to do abdominal strengthening, and it's going to work. I promise. It'll take 5 minutes a day.